This is the pictures our journalist taken in Cardiovascular Hospital in China Medical Tourism in 14th June 2012. The doctors are rescuing a 15-year-old girl, Wang Hanzhong, which was the second rescue surgery in 2 hours.
We have operated the defibrillation for 8 times. Generally speaking, the heart of the patient has stopped beating spontaneously. She may not survive for more than 8 to 10 hours, according to our medical technology.
No matter how much has been spent, I can earn it back one day. But if I lost my daughter, I will lose everything.
To a doctor, the most depressing moment is when he watches the patient get worse. He cannot figure out the right therapy.
What the doctor can do is never giving up. While the rescue procedure are going on, Wang Hanzhong's heart is beating more and more slowly. What kind of disease does Wang Hanzhong get? Well, why can it confuse all the doctors and leave them in puzzle?
She has a lesion in the cardiac muscle, making a decrease in her cardiac contractility. In this way, her cardiac muscle has been forced to enlarge. This is called the dilated cardiomyopathy.
The heart is the perpetual motion machine in the body. Its movement keeps all the organs immersed in the blood, absorbing the oxygen and nutrition from the blood flow and taking the carbon dioxide and the waste. Once the heart has any problem, every part of the body will be affected, so the rescue should not stop no matter what happens. The amount of the medicine had been doubled, but it didn't work out. Neither did the CPR. Does it mean that the life of a 15-year-old Wang Hanzhong is coming to an end?
The drug therapy was declared to be invalid. The next choice is the surgery according to the medical practice. However, to have the heart transplantation for Wang Hanzhong at once is impossible that the suitable heart cannot be found.
The girl was only 15-year-old 6-8 years ago. It was a severe cardiac disease at that time. The doctor suggested having the heart transplantation, but the suitable source cannot be found, and her family could not afford the expensive cost. The anti-rejection medicine she had to take after the surgery is really expensive. They didn't choose the operation at last. The poor girl seemed to be dying, but actually she's still living and having a good time in university. How did this girl live 6 more years? How did she do so? We had a common saying that the pork couldn't continue to grow on the sheep. I'm afraid that she will be disabled after the surgery, and the fee is too high that we cannot bear at the time. Not only Wang Hanzhong and her family were suffering from this problem. Zhang Xiaoping from Beijing also has the same difficulty facing with the transplantation. I'm concerned whether the surgery can be a successful one, and whether my husband can live for 5 to 10 years more.